There is a poster this meeting about the GLOW study, which is ibrutinib plus venetoclax as a time-limited option, and it was compared to chlorambucil obinutuzumab in elderly unfit patients. And we earlier reported on improved PFS, progression-free survival. Last conference, EHA, we showed improved overall survival in this group. And now we zoomed into genomic aberrations. Are there some kind of genomic aberrations that predict a better outcome or a poorer outcome? And so far, there's not a very clear group of patients that you say, well, this is not a good drug. Actually, you see that there are responses all over, both in patients with high genomic aberrations, with low genomic aberrations. So at this moment, there is not a clear group that you can say they really benefit, or the other way around, that they really not benefit to this combination, which is of course very different in chemoimmunotherapy, where you have these groups that hardly respond to anything. In the same trial, we examined MRD, minimal residual disease, and also if yes or no there is an association of MRD and outcome. Well, first of all, for this kind of trials with these novel agents, it's maybe too early to very clearly say how outcome is affected, because you really have to wait a very long time, and of course a good thing before you get progressions. But so far what you see is that patients with undetectable MRD of course do very good. But on the other hand, what you did not see with venetoclax plus CD20 antibodies is that also patients with a measurable MRD did very well. And so it's much less than we have seen with chemotherapy or venetoclax and CD20 antibodies, that you have this very black and white MRD prognosticator for progression-free survival. It seems that patients with undetectable MRD for sure do well, but also patients with MRD positive disease seem to do also pretty okay. So if these lines will really deviate in a few years to come, I do expect that, but so far it's not that clear, and I think even the MRD positive patients seem to do pretty okay, and that might be the reason behind that might be that with this combination you not only clear the blood, but also the lymph node and the bone marrow. And since all those compartments actually communicate with each other, that could be the reason, but I'm not sure yet.